Detectives, innovators, counselors, advocates, and humanitarians, you're invited to meet the medical doctors of the OC Healthcare Agency.
My name is Inglis. I'm a psychiatrist here at the county, the healthcare agency, and I work with behavioral health. I went first to school at the University of Illinois in Urbana studying biology, and later went to complete medical school at Chicago Medical School. After completing medical school, I stayed and completed psychiatric residency also at Chicago Medical School. After completing residency, I worked in Chicago with a large clinic doing psychiatric consultation, and I managed inpatient, outpatient, and day programs. From 1997, I came to California and I was working in hospitals with Gerald Psychiatry, and from there I started a private practice in South Orange County, working with various hospitals and outpatient programs. And finally in 2003, I came to the county to work with the more chronic and persistent mentally ill, which is what I was specifically trained to do. Initially, I was very interested in biology and the basic sciences and health in general. So when I was studying biology, I was doing pre-med, and I was very interested in being more of a leader position and advocate for patients. And while I was in medical school, I took up a position where I was doing research with the psychiatry department, and I learned that I was interested in psychiatry, so that when I finished medical school, I decided rather than go through the typical match and going through regular medicine, which was what I had intended to do, I just continued to stay at my school and assigned to go into psychiatry. I have a really great position here in the county because they have given me the privilege to work with the Collaborative Court program for the last 3 to 4 years, which is a really great program for the community, for people who have been arrested and they have a severely mental illness problems. They can do this kind of deferment rather than going to jail. They can come to a program where they must work with the judge, with the program to get their housing straightened up, their life straightened out, not be using drugs, take their medication, and if they follow this program for at least 18 months, depending on how they're doing, then their record can get clean and they can be back as a productive member of society doing the best they can. Before this, the only thing for people who broke the law with mental illness was to serve time in jail, which didn't really address their mental health needs, and it didn't help the community to have people who were nonviolent and making crimes that were clearly related to mental illness. It's not just about a program for those with mental illness that break the law. It's about a program for people who break the law that are clearly psychotic or having a severe mental illness, and the behavior that got them into trouble with the law really connects to the mental illness they have. So it's not so much that we're looking to be treating people that are having criminal behavior, but more like psychiatric behavior that causes some infraction with the legal system. So this is a really great chance for people who are not really criminals to be able to get their life in order, have social services that help them actually get their medications, get housing, get benefits, so that they can be productive to the best of their abilities. These people are referred through the courts. So they're arrested in jail, and the public defenders know about the program, and then they refer to the program. And then when we go to court every other Thursday, it's myself and the and a case coordinator, and we do evaluations there if they meet our side. So the court does an evaluation whether they meet the legal requirements. That's why it's collaborative, because the court is involved, and then we as healthcare agency are evaluating for our side if they really have mental illness, and is the mental illness really related to the issue, and is it something we could treat and help. So if we can meet if they meet our requirements and then they meet the court's requirements, then we bring them into the program if they're willing to do it.